Hi, my name is Trisha, and I want to thank you for coming to my presentation regarding Gore's cardioform septal occluder that we're going to start using here at the VA hospital. The VA in Loma Linda is a 400-bed hospital that offers a wide variety of services. We strive to fulfill our mission statement by serving and honoring men and women who are American veterans by offering them options to timely, quality services for veterans through care and respect for one's physical, psychological, and spiritual health. We honor our core values, which include integrity, commitment, advocacy, respect, and excellence. Today, I want to talk to you about the model of care for PFO closure using cardioform. We have recently seen an increase in vets needing PFO closure because of left to right shunting, which puts the patient at a high risk for a cryptogenic stroke. Using the cardioform with antiplatelet therapy has been shown to decrease the risk of cryptogenic stroke in patients between the ages of 18 to 59. Right now, we're sending patients to Loma Linda University, which is close to our facility across the street, and we are contracted with them. However, this adds additional costs to the procedure as well as a delay in care for our veterans. So to uphold the mission statement of providing high quality services in the community, the VA in Loma Linda wants to increase services by offering PFO closure via percutaneous approach. The strategic plan will include the interventional cardiologist, Dr. Trong, to be proctored at Loma Linda University using PFO closure device cardioform septal occluder until he feels competent to perform the procedure safely at Loma Linda. In the meantime, standards of practice for intraprocedural and post-procedural care will be formulated in collaboration with the nurse managers, with cath lab, as well as short stay unit and PACU, and the physician will be in. Dr. Trong will be involved as well. Cath lab nurses will receive an in-service from cardioform representatives in performing the procedure. Cath lab nurses will also observe the procedure at Loma Linda University as well. PACU and short stay nurses will be in service by a physician and the cardioform rep regarding post-procedural care, monitoring policies, complications to look for, interventions to be performed associated with complications, and discharge education. The nurse managers will also formulate a form for reinforcing discharge education that will be sent home with the patient. And the cath lab manager will ensure that all necessary supplies are ordered and in good working condition. When developing a strategic plan, we have to look at the strengths, which is increased revenue by saving money spent from transferring patients to a contracted facility. The weaknesses, which may include the fact that there's lack of knowledge, which may result in an increased risk for complication. And there may also be staffing or bed issues because of the increased number of patients that will be being received in PACU and short stay. Opportunities, though, increase services and benefits to the veterans and decreasing the delay of care and preventing cryptogenic stroke. And threats include post-procedural complications, which may arise after the patient has been discharged, causing rehospitalization within 48 hours, causing a decrease in reimbursements. To market this service, the marketing department has identified an advertising campaign which will be placed on the VA patient care website, providing information about PFO closures. Veterans previously diagnosed with PFO will automatically be identified and notified of the new available service. And if they're interested in receiving more information, an appointment will be set up with a cardiologist. Website information will include the risks and benefits of the procedure, signs and symptoms a patient may be experiencing, which would prompt them to seek advice from their primary care physician or neurologist. And the primary care physician and neurologist will also be educated on the new services and encouraged to refer patients who have signs and symptoms of PFO, including cryptogenic shock or TIAs in the past, to cardiology for further evaluation. So this chart illustrates a service line and volume projection that we're projecting for the next 3 years. So the average cost for patients receiving PFO closure at Loma Linda is costing the VA anywhere from $12,000 to $15,000. When we project that the average cost, if we do it here at the VA hospital in Loma Linda, it will cost approximately $3,000 to $5,000 per patient. So in 2022, we sent 4 patients to Loma Linda for PFO closures. And in the future, in 2023, we project we'll be doing 6 PFO closures, which will save the hospital $54,000 for 2023. And in 2024, we project doing 10 procedures, which would save the hospital about $90,000. And in 2025, we project 12 closures, which would save $108,000. So the total projected savings for the next 3 years would be about $252,000. In conclusion, offering PFO closure using cardioform is proven to be a safe and effective approach in treating PFOs in the vets and decreasing their risk for cryptogenic stroke. Beginning the PFO program requires very low cost. There's no need for additional construction or staffing. The program only requires nursing education and creation of policies and patient education forms. The PFO program generates revenue by saving the hospital an annual projected savings of approximately $54,000 in 2023, $90,000 in 2024, and $108,000 in 2025, with the 3-year savings of $252,000. And lastly, offering PFO closure increases available benefits and services to the vets and honors our VA mission statement. This concludes my presentation, and if there's any questions, please feel free to ask.